There is an international criterion for ROP divided into 5 stages. In stage 1, there's a white, flat demarcation line between the posterior vascularized retina and peripheral, non-vascularized retina. Then in stage 2, the line becomes elevated and forms a pink-white ridge. In stage 3, there's a fibrovascular proliferation from the said bridge. That can be extraretinal. In stage 4, there's subtotal tractional retinal detachment, and in stage 5, a total retinal detachment occurs. For adequate treatment of ROP, there are different zones that we need to be aware of within the retina. Zone 1 is demarcated by red areas in the picture on the right. This is the inner zone that encompasses the optic disc and up to 60 degrees from the optic disc. This is an area equivalent to a circle with a radius that's twice the distance from the disc to the macula. Zone 2 is the area between zone 1 and the circle centered on the optic disc and tangent to the nasal ora serrata. And lastly, the zone 3 is all of the remaining temporal area of the retina, and it's identified as the green area. When well managed, symptoms of retinopathy of prematurity can be asymptomatic. Signs of ROP may include shallow anterior chamber, corneal edema, and iris atrophy. Pupils can be impaired in its dilation, and there may be posterior synechia present between the lens and the iris. Ectropia on UVA is the presence of iris pigment epithelium on the anterior surface of the iris. And you can see that on the top right picture. And ROP can also have, in severe cases, vitreous hemorrhage, and in stages 4 and 5, retinal detachment. One complication of ROP includes the plus disease, which is at least 2 quadrants of shunted blood. This causes an vascular engorgement in the posterior pole with tortuous arteries, as demonstrated in that picture, and dilated veins. Vitreous haze and pupillary rigidity can be present simply because of the stiffening of the iris due to vascular engorgement. Coates disease, Eales disease, familial exudative vitreoretinopathy can present with similar constellations of signs. And these are some of the other diagnoses that must be ruled out before settling on retinopathy of prematurity.